Hi, my name is Greg Fell. I'm Director of Public Health, and this is a short video on shielding, what's changing. This is difficult stuff. It's worth me saying why this is changing. 3 months ago, the level of circulating virus was much higher than it is now, much higher. Now it's quite low actually, and we're trying very hard to keep it that way. So the kind of the risk benefit balance has changed. People will want precise quantifications of what is my risk, doc. So the risks to an individual should they become infected is fairly constant. And the reason why shielding policy existed was because some groups of people were at much higher risk of very severe illness. That hasn't changed. That's constant. But what has changed is that your likelihood of becoming infected as the level of circulating virus is much lower. And so that changes the risk benefit balance, because obviously being cooped up at home carries its own consequences. So what can people do now? Number of things. Leave home, but maintain fairly strict social distancing, maintain hand hygiene. I'd recommend that people wear a face covering as well. Spend time outdoors with members of their own household, or if they live alone, with one other person. That changes from the 6th of July. What can happen from then? You can meet in a group of up to 6 people outdoors, including from different households. But again, the recommendation around social distancing remains. You no longer need to observe social distancing with members of your household, and that's big news and welcome news. And you're able to form a support bubble in line with guidance for support bubbles. And again, that's online. I won't dwell on that now. From the 1st of August, it's likely government will be advising that shielding will be paused altogether. I think that decision hasn't quite been made, but it's likely that those shielding will be advised to adopt social distancing rather than the full shielding measures. And it's likely that centrally provided food boxes and medicine deliveries will stop. So that will mean effectively that people who are shielding can go to work if they can't work from home, as long as that business is COVID secure or COVID safe. Children who are extremely clinically vulnerable, the shielders, can return to school settings if they're eligible and in line with their peers. But again, they should practice frequent hand washing and social distancing where able. And people who are shielding can go out to buy food, can go to places of worship, and or for exercises, again with strict social shielding. People shielding should stay at home where possible, and follow strict social distancing. But again, the recommendations are changing, and so as the level of circulating virus goes down, the level of risk of being infected goes down. So that's why the recommendations will continue to change. I recognise that it's difficult to precisely quantify this stuff. So the things that will be constant throughout are the things that probably make most difference. So if you know of people that have symptoms, avoid them. They should be at home, actually. If you wash your hands frequently, if you don't touch your face regularly, if you maintain distance from other people, all of those things will reduce the chance of infection. So I think we'll come back to this time and time again as the policy evolves, but it is evolving.